I'll see it all the time. People will kind of, get to the end of a certain thread or a certain channel, and they'll have this really genuine, intrinsic, positive cognition that will show up that will be like, I am good enough. I am a good mom.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome to the Medical Trauma Support Podcast. Today, Shelley Freeman is here talking to us about birth trauma. And Shelley is a therapist in North Carolina. She works with moms. A lot of the moms she's working with are in the early stages of pregnancy, birth, early postpartum, but she works with moms throughout the mothering spectrum. And Shelley and I have had multiple conversations about birth trauma and how common it is and the significant impact it has on the mother, the partner, the babies, the family. And so we have decided that we want to do a 3-part series on birth trauma. And so you are listening to our first of 3 podcasts with the focus on birth trauma. So Shelley, would you like to introduce yourself further?
Sure. Okay, so let's see. Well, so I'm Shelley, and I am physically located in North Carolina.
Mm-hmm.
I see clients in North Carolina, Virginia, South Carolina, Florida, and DC. And I've became certified in EMDR over the pandemic, and that is a big piece of what helps me to understand trauma and working with moms, especially, all the things to the journey to and through motherhood. Yeah.
That's beautiful. Well, because you're working with moms, I know that you work with a lot of people around their birth trauma. And I was thinking that maybe the first thing that we could talk about is how common it is. Like, what is the prevalence of birth trauma?
It really, birth trauma, what the statistics tell us is it's like anywhere from 4 to 5% of birthing people. And usually it's about, they'll say 1% of birthing partners developing PTSD, essentially. And when I think of birth trauma, I'm thinking of not necessarily a PTSD diagnosis. And I think in this case, when you think about the statistics really talk about PTSD and birth trauma, and that being about 5%. I think most, and maybe it's just because I work with a lot of birth trauma, so that could skew this a little bit, but I think that most birthing people have these sticky moments in their birth. And when I say that, I mean, it's those moments where you're like, like there's something there, or that didn't go right, or I wish that could have been different. And when we look at that, we're looking at a very higher rate.
Yes.
But that's harder to kind of quantify.
Yeah. And I think, I have a background as a doula, which I don't think I've really talked much about in this podcast, but, having worked with people and, working with them on creating their birth plan and this like birth that they hope to have. And that oftentimes that's not the way that birth goes. And that doesn't necessarily mean it's going to be a trauma, but like you said, there is oftentimes like some grief and even feelings of loss for not having the birth that you had dreamed of and the birth that you had planned for. And so I have experienced that as a doula as well, that there are often times, even when it's a pretty positive experience, that there are things where there is some grief and loss that goes along with it.
Absolutely. I mean, that piece of, and I think this is where that trauma comes in, that trauma component is the expectations of the birth versus the
Mm-hmm.
reality.
Mm-hmm.
And that being, gosh, a lot of people have a birth plan and will want it to go a certain way. And then, they end up needing an emergency C-section.
Mm-hmm.
Um, Most people, that's not a part of their birth plan. And
Mm-hmm.
so whenever reality is not lining up with these expectations that we have
Mm-hmm.
about, it's supposed to be a beautiful experience, and all the positive things that you hear, which
Mm-hmm.
that can still be in the midst of some trauma. Um,
Mm-hmm.
it's yeah, those expectations versus reality. It's a big piece.
Yeah, for sure. And to talk about, somebody who is not expecting to have a surgery.
Hmm.
Oftentimes it happens after a full day or days of labor. You are exhausted. And to then go into the experience of having a surgical procedure and the impact that that has on your body, um, that at the same time, that surgical procedure is also your birth. It's the birth of you as a mother, whether it's the first time or the birth of you as a mother of three, and it is the birth of your child. And so there are so many layers.
Hmm.
There's so many layers to birth trauma. And
Hmm.
again, like, we've talked about some of the experiences, while not traumatic, there is still a sense of grief, then all the way to experiences that really are incredibly traumatic, where there is loss
Hmm.
um, of a child, loss of a mother. We there are women who have obviously died in childbirth. So yeah, the birth trauma spectrum is
Hmm.
incredibly wide.
Absolutely. And some things that can really, gosh, even kind of increase the likelihood of there being birth trauma from a
Hmm.
birthing situation, things like lack of informed consent,
Hmm.
increasing that sense of loss of control.
Hmm.
And it can be in the smallest of things. It's interesting what our brain will hold on to, or kind of can even get stuck in the nervous system
Hmm.
and need help in being reprocessed in order to, kind of integrate that into the experience. But that lack of informed consent, things being done to you, not with you,
Right.
not with you being, the one that, when it's reasonable, being able to decide how you're going to move your body,
Right.
um, the people you want to rely on for support, um, all of these things. But it's this informed consent piece is such an opportunity, I think, for the birthing person to have a voice, but then also for the providers, the nurses, the doctors, the doulas, everyone involved, um, to be able to take that very, very seriously and be
Hmm.
able to provide that, even in the
Right.
smallest of ways. If there's an option to provide that informed consent, asking what they would like, how they would like it done, if it's feasible,
Hmm.
just can be really, really protective.
Absolutely, because you are honoring somebody's autonomy.
Hmm.
And this is a person who is stepping into this incredibly important role of parenting
Hmm.
right after the birth. And what happens in the birth impacts parenting, how
Absolutely.
we're cared for, how we're listened to, how whether we're respected or we're not respected.
Hmm.
I think another piece to it, when you were talking about some of the pieces that can be really impactful in the birth, is there has also, I have witnessed fear being used as a tactic to get somebody to consent to something that they don't feel comfortable with. And I think that brings in a really definitely increases trauma, but brings a sense of not feeling as safe,
Mm-hmm.
not being able to trust. And that has been very challenging for people that I've been supporting as a doula
Mm-hmm. Mm-hmm.
in their birth.
Yeah, that sense of power.
Mm-hmm.
Um, it can be kind of taken away in very small and large moments.
Mm-hmm.
Not feeling listened to, increasing that sense of helplessness. When we
Mm-hmm.
have those factors going into and with a birth, the likelihood of trauma is definitely going to go up.
Mm-hmm.
Um, yeah. Yeah.
Yeah. And having that freedom to make your own choices and to be able to move your body in the way you want to move it.
Mm-hmm. Mm-hmm.
Really, yeah, it gives you more of a sense of control
Mm-hmm.
in a situation where birth, we really don't have a lot of control. Like we may go into it feeling like we have a lot of control,
Yeah.
but our bodies and our babies are working together, and it's going to be different for most people
Mm-hmm.
every time with each new child that they have.
Mm-hmm.
So it's kind of I often think of it as like our practice in parenting, right?
Mm-hmm.
Because we don't have control as parents. You cannot force another human being to go to sleep.
Mm-hmm.
You can't force them to use the bathroom. I mean, there's all these things
Yeah.
that I think you learn through having to let go of control in birth, let go of control in the sense of letting your body do what it needs to do and take the time it needs, that are, I think, very helpful as you step into the role of parenting.
Absolutely. And I mean, that sense of control, I know this is something in the EMDR community that is talked about often with when we identify negative cognitions, negative beliefs about the self.
Mm-hmm.
And if somebody comes up with that belief, I'm not in control, it's
Mm-hmm.
like, well, there's some truth to that, right?
Mm-hmm.
There is.
Yeah.
Um, but in that moment, I think what is helpful is to be able to identify where you do have control.
Mm-hmm.
Um, and I mean, you're right. This is an experience that most people go into. I mean, even if you have given birth before, it's likely in a new room, a new hospital, possibly with a different partner. It could be, I
Mm-hmm.
mean, a variety of differences, a different doctor, a different team.
It could be a birth center. You may go from having your first in the hospital to
Mhm.
your second or third in a birth center or at
Mhm.
home. Yeah, experiencing a really different type of care.
Absolutely. Yeah. And then we're looking at too that sense of, if you're going in for your birth and you already have this history of trauma that you haven't
Mm.
dealt with,
Yes.
or you haven't healed, you know, from that, or you've had other medical situations that were traumatic, that's going to be
Mm-hmm.
right there,
Mm-hmm.
kind of almost like on your shoulder, just like right
Mm-hmm.
there, during the birth. So it being very important that we, as much as we can, work on the trauma before we're in these situations where it can be triggered again. Um,
Yeah.
yeah.
I also think just knowing that,
Mhm.
so I have 3 kids. With my first birth, I think I felt like, oh, I'm going to walk into that room with like the birth class I took. What I realized is that no, you walk into your birth with every experience you've had in your life. You are still yourself and every experience that you've had going into the birth room. And yes, taking classes and doing work is gives you so many tools, but just to know like you're still yourself, you still bring in the struggles, you still bring in the traumas. And when you talk about how oftentimes a trauma history can impact your birth, I think that's really true for all medical procedures. And not that
Yeah.
birth is entirely medical, there's so much more to it. But
Mhm. Mhm.
oftentimes, like if we have a history of complex trauma, we're bringing that in with us. And there may be a higher chance of us experiencing something as traumatic because of that history that we've got. But
Absolutely.
like you said, like knowing that and even doing some work beforehand can be incredibly beneficial.
Mhm. Absolutely. Absolutely. And I was thinking too, that piece, with the birth trauma. I mean, another piece that can kind of increase the likelihood of something, being traumatic around your birth is that separation from baby.
Mhm.
And this often happens in situations, gosh, where there is like a medical emergency.
Mhm.
But as much as we can do as possible to not separate the birthing person from the baby, um, the better in order to just mitigate and decrease the likelihood of trauma. And I
Absolutely.
think trauma really for the birthing person and for the baby.
Yes.
Yeah. Yeah.
Yeah. And I think oftentimes we don't in this culture necessarily um, think about the experience of the baby and the birth. I think oftentimes we're thinking about our birth plan and we want what we want it to be, and we can build things into that can help make the experience more gentle for the baby. But we don't necessarily put that as the first priority when we're birthing in hospitals in the US.
No, no. And what's interesting is I've done some work and I've done some trainings with pre-verbal trauma.
Mm-hmm.
And I mean that's a whole nother podcast probably, but um, that being just such an interesting piece where oftentimes someone's own birth story can come forth.
Mm-hmm.
And it's, things that they experienced and sensations and um, that maybe they didn't even know about their own birth that is coming in with the pre-verbal trauma EMDR work. So that's an interesting piece too.
Absolutely. Like, yes, that is such an
Mhm.
important piece. And I think when we have had traumas or big experiences in our lives that are kind of re-triggered, it can come up when we are then the person giving birth, that trauma that we have no like logical memory of, but we
Mhm.
have oftentimes, pre-verbal trauma comes up as sensations.
Mhm.
Um,
Mhm.
or even it can come up as like images. Like,
Mhm.
I mean,
Mhm.
I would love to hear more from you about that, like when you are working with people with EMDR and what that has looked like when pre-verbal trauma has come up.
Well, gosh, pre-verbal trauma, it has kind of its own separate protocol that you
Mhm.
use that is different from the standard protocol with EMDR.
Mhm.
So it's a little bit d- different, excuse me, and complicated. But it's definitely, I mean, part of it is that piece in that it's similar to the standard protocol with EMDR, where we're looking at like thoughts, feelings, body sensations, images.
Mhm.
And part of it is just, I mean, it's just a noticing what comes up while we're
Mhm.
using what we call dual attention. So that means we're right here, right now, but
Mhm.
we're glimpsing also at the same time into the traumatic event, traumatic memory,
Mhm.
um, image, and being able to apply the bilateral stimulation, which is like eye movements, like back and forth, or taps back and forth in a bilateral way.
Mhm.
Um, and being able to just stop and pause between sets and just say, okay, what are you noticing now?
Mhm.
And people will notice images, they'll notice thoughts, feelings, body sensations, and then you apply the bilateral stimulation again
Mhm.
and you keep going. And the cool thing about this is that your brain and your body know exactly where you need to go.
Mhm.
And so there's nothing that you have to do to make it happen.
Mhm.
We're naturally wired towards healing. Our brains
Mhm.
are naturally wired towards healing. And we know exactly where we need to go. And I'll see it all the time. Um, People will kind of, get to the end of a certain thread or a certain channel, and
Mhm.
they'll have this really genuine, intrinsic, positive cognition that will show up that will be like, you know, I am good enough. I am a
Mhm.
good mom. Um, and it's not just them telling themselves, it's that they're actually feeling it.
Mhm.
Um, Really just like mind, body, spirit, like they're like, wow. And they can look back then on that traumatic incident and be able to see that and hold that positive belief about themselves. Like,
Mhm.
I'm okay. I'm safe. I'm a good mom.
Mhm.
I was a good mom in that moment. It's really, it's powerful.
Yeah. That's
Yeah.
so beautiful.
Mhm.
That's so beautiful. And I think too, to be held in a space with someone who is witnessing, in an unconditional, unconditional positive regard
Mhm.
kind of way, and being with them, because with trauma, when it happens, we feel overwhelmed and alone.
Mhm.
And so to be able to revisit that with somebody who is there with you and who is attuned to you, like,
Mhm.
you as the therapist is there, they're attuned, you're not alone in it. It's done in a way that isn't overwhelming to your system.
Mhm. Mhm.
So,
Absolutely. Absolutely. Yeah. It's a powerful thing. It's a powerful
mhm,
thing. Um, because essentially what we're looking at with the trauma is that trauma creates kind of this disruption in the normal processing that would happen, information being processed in our brain.
mhm,
And it can leave these unprocessed, trying to think of the best way to say it, like unprocessed, well, information or kind of chunks there that need attention to kind of reprocess all the way through.
mhm,
Um, and in doing that, then that's really where the healing takes place.
mhm. The way that I'm visualizing it is almost like, um, little knots or something, and it's like then you can go back and you can kind of unknot it, and you can just stretch it out and see in this kind of clean and organized way, oh, this is what happened, with those more positive beliefs sitting on top of it, of, like you said, like, I am a good mother and here is what happened, and almost like that I'm a good mother is now intertwined with these threads. As
Right.
you were explaining that, that's just the image that
Yeah,
really came into my mind.
absolutely. Because we already we already have so much adaptive information in
Mhm,
our brains and our nervous system that are there, um, that helps with this natural capacity towards healing. And so then when something like a birth trauma happens, it's going against what you expected your reality to be,
mhm.
feeling things of helplessness, hopelessness, loss of control, and also related to safety. Like, wow,
Yes.
okay, I'm not safe. This is really scary.
Yeah.
But we're able to kind of unclog those channels or those networks with the
Mm,
bilateral stimulation
mhm,
in a way that allows that adaptive information to imprint on and be available for these traumatic experiences.
mhm,
So, being able to still look back on a birth trauma and be able to say that was really hard and difficult, and I never want to do that again.
mhm,
But also, too, I can notice some positives about how I handled it,
mhm.
how I dealt with that. Um, and also, too, I can think about it, not feel my whole body responding,
Right.
you know?
It doesn't take over.
Hmm.
It's
Yeah.
like you explained it, like you can be in the here and now,
Mhm.
and there can also be this experience, and it doesn't make the experience go away, but
Mhm.
it doesn't become who you are anymore. It doesn't take everything. It's like, this is who I am. I'm here, I'm present, and I
Yeah.
had this experience.
Yes. Yes. Absolutely. Yeah. And this is a lot. I mean, you think about it, this is a lot for moms to be having to digest when all of a sudden they say if, through the birth trauma, they have the baby lives.
Mhm.
Um, and then it's kind of like, okay, you've got this motherhood of this um fire hose just like coming at
Mhm.
you. And it's
Mhm.
like, okay, I've got to attend to this crying baby and help and heal and but then how am I supposed to deal with my birth?
Right.
And then a lot of people are saying, oh, well, I mean, the best outcome is you both are happy and healthy.
Mm.
And it's like, it's so minimizing and invalidating of your
Yes.
experience.
Yes.
It's like, well, you should just be grateful. Like, "Mm, no, no." So
Yes.
I think being able to approach moms, birthing people with compassion and curiosity and not
Mhm.
just assume that they're feeling okay or that everything went well because she's alive, baby's alive, and, you know, they're doing okay. It's
Right.
like, get curious about that. Ask, that was an intense situation. How are you feeling? What,
Right.
what do you need? Yeah, that I think that minimizing happens early on for moms, oftentimes in
Yes.
a birth experience.
Absolutely. And I think too that experience, for any birthing person, new mother, oftentimes what they have just experienced is minimized,
Yes.
regardless of how the birth went.
Mhm.
The um what it takes to step into birth, regardless of how the baby is birthed,
Mhm.
you were like a warrior. And I
Mhm.
remember in my doula training, which is now over 10 years ago, I still remember this story, but I cannot remember the name of the tribe. But there is a tribe that when the mother returns from birth with her baby, she is treated in the same way that a warrior is treated. Yeah,
You
I
know
have
what
the
that makes
chills.
me think of? I remember giving birth, and it was my first my first birth, so I've had two. And I remember it was sometime after we got home, and I remember being in the grocery store in line. And it only a few weeks out from giving birth, like, and I wanted to like tell people, like, do you know what I just did? Like,
Exactly.
I was like standing in the middle of the grocery store, like, oh my gosh, like that word warrior is so, yes, that is it. I mean,
Mhm.
I wanted to be like, I'm freaking amazing. Like, I just did that.
Yes.
Yeah, it's powerful. And we
It
should
is
do more
powerful.
of that instead of sending moms back to work after like 6 weeks. I mean, it's inhumane.
Yeah, it really is. Yeah, I think yes, we deserve that honor and like a symbol of it, like we should have some kind of badge that we wear that says we have just gone through one of the most intense experiences that
Yes.
any human being can go through. Please acknowledge it. Please validate it.
Mhm.
Like you talked about validation and um, how important that is when somebody's gone through something hard,
Yeah.
to be
Absolutely.
validated for their feelings. And whether you think what they went through was hard or not, if they say that what they went through was hard or they say that what they went through was traumatizing, that is their experience. So validate that.
Yeah.
To be like, oh, I don't think that would have been hard for me, or I don't think that would have been traumatizing for me, is just one of the worst things you could say.
Mhm.
You know?
And I think part of it is our system is not set up to do good nurturing care for the
Hmm.
birth person, right?
Right.
And I don't. blame that on individual doctors or nurses. They're doing, their best in a mostly, not 100%, but mostly dysfunctional system.
Mm-hmm.
And that that sense of, okay, after maybe the birth trauma is over, kind of, okay, mom and baby are fine, like they're, alive, they're doing what they need to do. But for people just to kind of come in and kind of stamp it with, wow, that was good. Yeah, that was, you did it. Yay, that's great. Like, and instead of, let's approach it with curiosity,
Mm-hmm.
because it's not the nurse's birth story. It's not the doctor's birth story.
Mm-hmm.
It is the individual woman's. And
Mm-hmm.
she could have a very different lens.
Mm-hmm.
And so, but I think a lot of times we don't have time in our system. So it will be automatically kind of stamped as, wow, you did a great job. Yay, that was wonderful. And it's like, then she's getting that message. Oh, I'm not supposed to talk about what wasn't wonderful,
Right.
what wasn't good, what didn't feel right. I'm supposed to focus on the fact that I'm alive, baby's alive, and that's it.
Mm-hmm. Yeah. Yeah. And I think too, in our next podcast, our next part of this 3-part series on birth trauma, that I think it's important that we also talk about the other ways people give birth. It's not
Yeah.
only in the hospitals. Like, many people are choosing to birth at birthing centers, they're choosing to birth at home,
Hmm.
and that they're all, you have like really a wide array of
Hmm.
choices.
Hmm.
I say that, but again, our system is not ideal in that some people don't have the choice to birth outside of the hospital. And there are many hospitals that don't have midwives for somebody who wants to have that kind of experience. Um, Birthing at home, at least in Texas, is oftentimes not covered by insurance. And so for a lot of people, home births are not accessible.
Hmm.
So again, I think we're like kind of back to what we started at talking about with choice, right? Giving people true choice.
Hmm.
But in our next episode, we'll touch a little bit on some of the other ways to birth. I
Hmm.
think that's
Hmm.
important to
Yeah.
talk about
Yeah.
because for some people, and for me personally, my third birth was a very healing birth after a
Hmm.
trauma with my second one. And I chose for my third to have my baby at home with a midwife, which was very different than my first 2 births in the hospital that had interventions, unexpected interventions. And like I said, a big unexpected trauma with my second one. So, in our next podcast, Shelley and I will talk more about experiences of birth trauma and how birth can be different depending on who your provider is, the location of your birth. Yeah. And Shelley, before we close out this episode, is there anything else you want to add?
I mean, I think, and this might be something most to add just every time, is that even if you dealt with birth trauma, you can heal from it. You
Mm-hmm.
absolutely can.
Mm-hmm.
And your brain and your body is naturally meant to do that.
Mm-hmm.
Um, and it doesn't matter how long it's been.
Right.
Um, you could have given birth yesterday, you could have given birth 20 years ago. It's all important.
Mm-hmm. Yeah, and I guess I should add too, talking about healing from birth trauma, that Shelley and I are going to be offering a 4-week series for mothers who have experienced birth trauma.
Mhm.
And we are it's going to be, a community. There's going to be support, camaraderie in the community. And we're also going to be doing some somatic practices. So really being with the body, learning tools that can help regulate if you are, um, struggling with some anxiety and things that can often come with birth trauma. And we'll do some movement practice. So we'll be doing some trauma-informed yoga as well. So I'll put a link to that in the show notes. And I'll also put a link to Shelley's practice. As she shared at the beginning, she works in a lot of different states, which is amazing, that so many different moms are able to access your practice.
Yeah.
So
Love it.
yes, well, I'm so excited. We have 2 more podcasts to come on birth trauma, talking to Shelley. And Shelley, thank you so much for being here and sharing your time and your expertise.
Yeah. Thank you so much.